why a feeding schedule helps, and what it can look like for a 6-month-old baby. If your baby has started solids, here is a simple day in the life. I will show you a sample meal, milk feed, and nap schedule. Structure reduced stress for all of us. So, what does a 6-month sample day look like? Here is a simple framework. Morning, a milk feed on waking, then play. Late morning, solid session, water in an open cup, then nap. After nap, milk feed, calm playtime. Afternoon, another solids exposure and a short nap. Evening, milk feed, wind down, and bedtime. This is not for comparison, but for ideas about spacing feeds, solids, and naps. Use what fits your family and leave the rest. You have got this. When babies are ready to start solid foods. Not all babies are ready to start solid foods exactly at 6 months. If your baby is not yet 6 months old, or 6 months adjusted age if they were born prematurely, and if they cannot sit on their own yet, they are not ready to start solid foods. Babies need to be able to sit relatively independently before starting solid foods safely. And the truth is, many babies are not ready exactly at 6 months. Some babies start sitting on their own at 6 months plus 1 week, others at 6 months plus 2 or 3 weeks. Once your baby is able to sit relatively independently and shows the signs of readiness, then it is safe to start introducing solid foods. When you begin solid foods, it is recommended to offer them 1 to 2 times per day between 6 and 7 months of age. You can choose whatever time of day works best for you, because it usually doesn't matter when babies eat solid foods. However, there is one important exception when introducing allergenic foods. If a baby is going to have an allergic reaction, it usually occurs within minutes and up to 2 hours after eating the food. So it is best not to introduce allergenic foods right before bedtime, because you want to stay awake and observe your baby for any possible reaction.
Ravens, if this video helped you learn something new, hit the like button, share this video with someone who needs it, and tell us your thoughts in the comments.
Milk feeding, nap timing, and learning to eat. At 6 months of age, your baby will still be nursing or taking bottles several times throughout the day, although usually less frequently than right after birth. Most babies around this age also take 3 naps per day. Learning to self-feed takes time. In fact, it can take babies about 8 weeks to really learn how to eat. During the first few days and weeks of starting solid foods, very little actual eating happens. Babies are mainly learning how to explore food. That's why it's important that your baby comes to the table happy, calm, and somewhat full from their milk feed. Breast milk or infant formula will still be your baby's main source of nutrition, even after starting solid foods. For timing, bottle-fed babies usually need about 1 hour between finishing their bottle and starting solid food. This gives their stomach time to empty a little. This is helpful because babies will often gag while learning to eat. Gagging is normal, but if the stomach is too full of milk, gagging can sometimes trigger vomiting. A little vomiting during the weaning process can happen occasionally. However, if a baby vomits frequently at meals, it may lead to negative associations with food and cause food refusal.
Daily feeding schedule for a 6-month-old. Here is an example of a simple daily schedule for a 6-month-old baby. Start the morning by waking up and giving your baby their regular breastfeeding session or bottle feed. After that, allow your baby to play and digest the milk. If you bottle feed, wait about 1 hour before offering solid food. Then you can try solid food meal number 1. Many babies can sit in their high chair for about 20 minutes for a feeding session, though some babies may take time to build up to that. After the meal, continue with normal activities until nap time. If your baby usually nurses or has a bottle before sleeping, you can continue doing that. After the first nap, you may offer solid food meal number 2, or you can simply do another milk feed and playtime before the next nap. After nap 2, repeat the same pattern: milk feed, playtime, and possibly the second solid food meal if you haven't already offered it. If your baby still takes a third nap, follow the same routine again. The key idea is to find 1 or 2 times during the day when solid foods can fit naturally between milk feeds and naps. Try to avoid introducing new allergenic foods less than 2 hours before bedtime. At night, complete your bedtime routine and finish with your baby's final breastfeeding or bottle feed. Then hopefully your baby sleeps through the night, and you can repeat the schedule again the next day. In summary, at 6 months your baby will still rely mainly on breast milk or formula. while slowly learning to eat solid foods once or twice per day. Be patient, because learning to eat takes time. Thanks for watching and happy feeding.
Parents, if this video helped you learn something new, hit the like button, share this video with someone who needs it, and tell us your thoughts in the comments.